can we measure the outcomes of IPT? The use of rating scales and assessment tools can be very helpful in being able to uncover that information and keep us accountable to the treatment goals and measure the effectiveness of it. Also helping layer the patient's confidence in those areas of skills. Are they experiencing a positive change? Are they experiencing less distress? Are they using these opportunities outside of therapy as well as in the therapy room to be able to explore the use of those new skills, practice those new skills, and really connect with their confidence in doing it? So several assessment tools are used in IPT to measure things like communication, emotion, boundaries, and stress levels. And here are some of the most commonly used tools in IPT. So we've got the Communication Patterns Questionnaire, and that's used to assess communication patterns and styles in relationships. It measures the extent to which communication is constructive or destructive, and looks at the degree of warmth, support, and control in the relationship. So how that information is delivered with conversations approaching conflict, renegotiation stage, or an impasse in a relationship. This questionnaire is particularly good at being able to identify the styles of communication in those settings as well, and can be used as a really helpful tool to form those goals of what we want to focus on. And with emotions, so assessing mood disturbance, the Beck Depression Inventory is a widely used and well-researched self-report questionnaire that assesses severity of depression and depressive symptoms. So it includes items related to emotional symptoms such as sadness, guilt, feelings of helplessness, perceived failure, and some physiological aspects of depression as well in terms of sleep and appetite disturbance. So when looking at assessing boundaries, and this is in line with what I was talking about before when we were going through this, the toolkit of being able to help people give permission to themselves to know that the boundary is okay to set, particularly if there's themes of unworthiness affecting their ability to give themselves the backing to do that. So this is a self-report questionnaire, the Personal Boundaries Inventory, which assesses the individual's ability to set and maintain those personal boundaries. So setting them and communicating them is one thing, but when the other person doesn't adhere to them or override the boundary, what do we do when faced with those situations? So it's how to maintain the boundary once it's set. It measures the extent to which an individual feels comfortable saying no, and that's also an opportunity for communication style and delivering no, and how to say no in a way that's effective for them, that they can deliver with confidence and feel comfortable. And setting limits on personal space, time, and privacy. Lastly, the Perceived Stress Scale is a self-report measure that looks at assessing an individual's perception of stress in their life. It measures the degree to which an individual perceives their life as stressful and the extent to which they feel overwhelmed or unable to cope. So that's a really good indicator of being able to think about how the person views themselves as equipped to cope with changes, stresses, or adjustments that are going on. It's important to note that there are many assessment tools available that we can use for each of these domains, and the choice of tool will ultimately depend on the specific needs of the patient and your judgment as the therapist. If there's things there in the initial session, things that are helping form our case formulation, we can draw upon those aspects to tailor decision making with the tools that we're going to use.